Chattanooga's Medical Society says there's a shortage of neurologists in the city. Local doctors say the wait list is currently 6 months.
It was 2 months in 2017. Kylie Thomas breaks down why this is a problem for patients.
3 neurologists have left Chattanooga in the last few years, and we told you in 2018 that Dr. David Rankin is one of them. Now patients are still waiting to be seen. Dr. Nathan Wyatt starts his day before sunrise.
Typical day probably starts with me getting up no later than 5:30, reviewing charts and records at home, getting kids ready for school, and then come here to the office.
He puts in 13-hour days because his patients are his #1 priority. The demand,
I personally would like to be able to see patients faster than we're able to right now,
is a close second. Wyatt and the Medical Society say the shortage is twofold. The specialty requires multiple hours with each patient. That means less appointments overall. Plus, he says 3 neurologists left Chattanooga in a 2-year period. Phyllis McKay is thankful that her mother with Alzheimer's only had to wait 4 months to find a new specialist. She realizes that others are facing even longer delays.
With all those patients without doctors, then she could have been, 6 months to a year finding another doctor without any treatment.
There are currently 15 neurologists here in the Chattanooga area. Although the government hasn't classified this as an underserved area, both the Medical Society and a local neurologist say they need more of this specialty to meet the demand. Reporting in Chattanooga, I'm Kylie Thomas, News Channel 9.
According to Tennessee law, a doctor closing their practice must notify a patient seen twice in the last 18 months. McKay says her mother would be included in this time frame because she saw him every 3 months. At least 10 patients have reached out to us to say they never received a letter or a phone call. Dr. Rankin told News Channel 9 that's not the case. He says his office called more than 1,000 patients. We asked the Tennessee Department of Health if any complaints have been filed. They say they are not allowed to release that information.